Osteopathic medicine, Dr. Mitch Ghen. Doctor, great to be with you today. So this is getting really, really confusing for a lot of folks. What do Americans need to know, and is there reason to believe that this outbreak could be larger than what has been initially confirmed so far?
Well, certainly it could be larger. By the way, thank you for having me on. The cyclospora is from a mouth to poop, basically, type of procedure that occurs. And when this happens, it could be coming from, because of the false positive, anything, any berry, any fruit, anything in the ground could actually be spurring this particular problem that we have. And yes, it could be much bigger because we don't know where it's coming from at this point. But we should take some precautions, that's for sure. And there is a very interesting study, if you'd like to know, that may help even in the beginning. Like the picture, it can give you terrible stomachache, awful diarrhea, can make someone nauseous, and this could last 7 or 8 days. And for the elderly or pregnant women, or for even someone younger, they're going to have much more problems with this than perhaps adults do.
Yeah, I mean, it can be very dangerous. Like you said, it can last for several days, especially, I'm sure, if you have an existing health condition. That's something to worry about, too. But, you know, there are a lot of Americans worried, should I eat lettuce? I love my salads, and I'll be honest with you, I have not had any since this outbreak. So do you have any advice for people besides just washing your vegetables?
Absolutely. Yes, you should clean your vegetables and be cognizant of what you're eating. But there is a study in the dish in 2009, again in 2023. It was republished in 226. Even though this was in a mouse and it was in a dish, it showed that the curcumin, which is the active ingredient in turmeric, the nice yellow stuff that everyone talks about, it actually worked better than the antibiotic Bactrim. So the question is, should we take it sort of prophylactically? Now, I do, my wife does, and my family does. And the reason is, it's innocuous substance for most. I'm sure you should check with your physician or healthcare provider, but taking that every day, it actually outperformed the sulfa drug that if you got the disease, you would have to take. So for any reason at all, it makes sense for us to be taking a tablet or two of curcumin a day, just because, even though it is only in the mouse, I caution you that way, but why not be somewhat proactive? And that's what I would tell my patients, as well as telling my family and the folks watching as well.
Yeah, that's really interesting. Also, do you think this is a time when folks maybe should think about, you know, buying locally, going to their farmer's market? I mean, is that a safer option than buying this bag lettuce?
Yeah, I think it would be a much safer option, especially if you know the farm. Now, I like to go with my wife to the grocery store that's nearby us. It's local farms that these things have come from. And still, by the way, I wash all of our fruit and vegetables because you never know. And one of the substances that you can use is called hypochlorous. You can find it pretty much anywhere. And that tends to kill this particular cyclospora and perhaps help you not get this particular problem. But again, being proactive, washing the vegetables, maybe you're right. Getting things that are more local makes sense. It makes sense, and you know where you're getting the produce from.
Yeah, absolutely. Help our local farmers as well. We're also talking about the wildfires and all that smoke coming over from Canada. And that really is impacting millions of people right now, you know, triggering, as you know, air quality alerts. How serious is wildfire smoke when it comes to the average person? And what are some of the health risks?
Oh, it's extremely hazardous. There are, just to give somebody a plane of thinking, smoke has over 1,000 substances in it. Now, we're inhaling them, and they're small. They're smaller than what we call a micron. Just for basis, it's 1 25 thousandths of an inch. So it's going to affect the heart, it's going to affect the lungs, it'll affect the skin, it'll affect your nose. Pretty much most of the systems can be identified and in danger from having this. So the point is, if you can, certainly stay out of areas like this. If you have HEPA filter, that's a perfect thing that you should be in. If you have to go outside and it's a smoky day, the N95 filter mask tends to help this as well. The best is get out of the way.
Yeah, really quickly, who's most at risk, and when should it be time to maybe seek medical attention?
The most at risk are certainly the elderly, the young, and also your pets, by the way. And if you start to get a cough, shortness of breath, any chest pressure, just not feeling right, fatigue, I would immediately go ahead and get some medical attention.
All right, Dr. Mitch, Ghen, thank you so much for your expert advice. We really appreciate it. Thank you so much.
Thank you for having me.
All right,